I'm Gary Schwitzer, Associate Professor in the School of Journalism and Mass Communication and author of this report to the Kaiser Family Foundation on the state of health journalism in the U.S. The most overwhelming data point is really the saddest one. About 94% of the journalists who responded to the survey said that bottom line pressures in their news organizations were seriously hurting the quality of healthcare news coverage. A majority of the respondents, more than 50%, said that there's too much coverage of sort of light, fluffy, feature-ish consumer or lifestyle health news, but too little coverage of health policy, too little coverage of the quality of healthcare and about disparities in the delivery of healthcare. Just under half of the journalists who responded said that their organizations sometimes or frequently based their stories on news releases without doing substantial additional reporting. This should be of concern to anyone reading these stories. And about 1 in 10 reporters, about 11%, said that his or her own news organizations sometimes or frequently allowed advertisers, sales staff, or sponsors to influence story selection or content. And more than a quarter of the respondents say they personally get story ideas from public relations firms or marketing outreach somewhat or very often. There are conflicts of interest around every corner in healthcare, and it is the job of journalism to independently vet claims that are made, not to contribute free advertising to the cause. That's not journalism, that's advertising. And under these intense pressures that people face in newsrooms today, I'm afraid, and we have evidence of this as the survey shows, that it is becoming much easier for vested commercial interests to have their own way with news messages that come to all of us. And we naively think that there's independent, vetted editorial judgment going on, when oftentimes, because of commercial pressures and the reality in newsroom, fewer people being asked to do more with less, that independent judgment isn't there all the time anymore. New media holds a lot of hope. Perhaps pushing hyperbole as much as I might have in this report. I think at one point I referred to as possibly ushering in a new golden era of healthcare journalism, where you can use new media and online assets to go into depth at the user's choice, to use multimedia to help explain things better than you might be able to just in text. And so in the newsrooms and with the people we talk to, unfortunately, many journalists are now having multimedia tasks heaped onto their already busy schedules and responsibilities without any additional pay. And it's like, take it or leave it, or you can join your colleagues who were just laid off. Yet some, even in the face of that, do embrace it and go out of their way to learn new media because they see we can't fight this, and some don't want to fight it. They see it as an exciting opportunity. So this is not an all dark, bad news story. There clearly is some glimmer of light at the end of the tunnel. At least things are being tried, and in healthcare, I should say that I think that health journalists are helping to lead the way in quality improvement as much as any other type of journalist in newsrooms today. And I'm following folks every day who are using Facebook and Twitter and social media networking opportunities to help dig and research and find people and tell their stories. And I think that's exciting